In this video, we are going to take a look at different types of IV solutions and how they work within the body when they are given. These are the learning objectives we will be covering in this video. We need to start by looking at a few terms and discuss them briefly as they relate to IV therapy. Osmosis involves the movement of water between two areas, separated by a semipermeable membrane, from an area of lesser concentration to an area of greater concentration. A semipermeable membrane is something which allows for the easy movement of water through it, but not necessarily particles or solutes within the water. So for example, here we have a semipermeable membrane separating two areas of salt water. We can see we have equal proportions of water and the solute, sodium, on each side. If water is added to one of the areas, the first response is always to equal out the concentration of solutes within the water through osmosis, by drawing water from the lower concentrated area to the higher one. Our bodies are constantly working to maintain the state of equilibrium, so think of it this way. Solutes draw the water, and wherever there is more solutes, the water will be drawn. It is important to note that the equilibrium osmosis strives to attain is not about the equal volume of water, but rather the concentration of the solutes within the water. So, if instead of adding more water, we add more salt to one side of the semipermeable membrane, the water will be drawn to the extra solutes on that side until the concentrations become equal once again, even if the volume of water becomes unequal in the process. Diffusion is the movement of particles or solutes themselves from an area of greater concentration to an area of lesser concentration. Osmosis always has to do with the movement of water, but diffusion applies to solutes in water or other things like particles in the air. A simple example of this is a woman who has just applied perfume. At first, the perfume particles are surrounding her, but over time they diffuse throughout the whole room and can be smelled by others. Going back to the last example of osmosis we looked at, we added extra solutes to one side, and the response was water being drawn over to that side to equal out the concentrations. Equilibrium was obtained through this, but now we also have a greater or positive pressure on the one side, with more fluid in it than it likes, and a lesser or negative pressure on the other side, with less fluid than it likes. Over time, water will slowly be drawn back across the membrane because of this negative pressure, causing the concentration to rise on the one side and to lower on the other. This time, the next step in order to allow for this, but to still try to maintain equilibrium, will be to diffuse some of the particles or solutes from the area of greater concentration across the cell wall to the other side. With a semipermeable membrane, the diffusion of solutes across it may take a little bit of time, and energy may be required in the process to actively transport the solute across. Once the solute crosses over, the water quickly follows by the process of osmosis to once again equal things out. One other term you may hear, and that it's good to be familiar with, is osmotic pressure. A basic and simplified explanation of this is the concentration of a solution, called tonicity when discussing IV solutions, and the strength of its ability to draw and hold on to water. The more concentrated a solution is, or the larger the solutes within it, the greater the osmotic pressure and its ability to draw and hold on to water. Think of it like one magnet being used to draw smaller magnets to it. If we double the size of the magnet, we'll see an increased draw of the smaller magnets to it. Alright, let's look at a few other terms now, starting with intravascular. Intra means within or inside, and vascular refers to the vascular system within the body, basically the arteries and veins. So intravascular means within the blood vessels. Then we have intracellular. Intra meaning inside or within. Cellular is pretty self-explanatory, referring to the cells of the body. So intracellular means within the cells. Keep in mind as well that there are multiple types of tissue cells in the body, and even things like red blood cells within the intravascular space. The fluid inside the red blood cells qualifies as intracellular fluid as well. Lastly, there's interstitial. Again, inter meaning inside or within, Interstitial basically refers to the tissues and space which the cells are surrounded by. So interstitial means within the tissues and spaces surrounding the cells. If you've ever seen or experienced edema, this is caused by an excess of fluids in the interstitial space. Now that we've covered these terms, let's move on to talk about different types of IV solutions and how they are classified. IV solutions applicable to midwifery can be broken down into three main categories: crystalloids, colloids, and blood or blood products. There are a wide variety of crystalloid solutions which contain different and varying amounts of solutes dissolved in water. Common solutes include things like dextrose, a simple sugar, and electrolytes like sodium, potassium, magnesium, chloride, and calcium. Over time, the electrolytes and solutes in crystalloids are able to be metabolized by the body and can be moved across the blood vessel walls and into the cells of the body. These are the solutions you as a midwife will most likely use with your patients. They are relatively inexpensive, readily available, and easy to store. We'll talk a little more about these solutions in a moment, but first, let's take a brief look at colloids and blood or blood products. Colloids are solutions containing water and electrolytes, like crystalloids, but they also contain larger colloid substances within them, like proteins, for example, albumin, which is a protein made by the liver. Blood or blood products include things like whole blood, packed red blood cells, platelets, plasma, and plasma substitutes. Both colloids and blood or blood products have a higher osmotic pressure than crystalloids because of the large proteins and molecules they contain. Two things distinctly different about these solutions is that the large proteins and molecules they are composed of do not dissolve or pass out of the blood vessels and into the cells. Also, whole blood or packed red blood cells contain hemoglobin, which is able to carry and transport oxygen in the body. Because of this, you can probably see why colloids are better long-acting and more stable volume expanders than crystalloids, and blood or blood products are considered the most ideal solutions for use with severe hemorrhage or blood loss. This is because they actually replace some of the lost blood and blood molecules in the body, as opposed to simply replacing volume, which crystalloids and colloids do. There are multiple reasons colloids, blood, and blood products are not administered by midwives. They are expensive, are not readily available or easy to access, are difficult to store, and some of them require cross-type and matching, as well as careful monitoring with administration, as they may cause severe allergic reactions. As a midwife, you won't be giving these solutions, but they are good to be aware of, as there may be patients you transport, such as for severe postpartum hemorrhage, who may require these types of solutions in the hospital. Going back now to crystalloid solutions, they are further classified based on their tonicity, their concentration, and they fall under one of three categories: hypotonic, isotonic, or hypertonic. It is important to note that the tonicity of IV solutions are defined in comparison to that of the blood and interstitial or intracellular fluids within the body, not to water. First, let's take a look at isotonic solutions. Iso means equal or the same, and tonic refers to its tonicity or concentration. So an isotonic solution is the same concentration as that of blood and fluids within the body. I know I've used dots to illustrate particles or solutes up to this point, but now I'm going to use blue dots to illustrate the solution, the adding of drops of the solution into the intravascular space, if you will. More specifically, the water portion of the solution to show its movement within the body through osmosis. I wanted to clarify that so you don't get confused here. When we introduce an isotonic solution into the intravascular space, no matter how much we add, the concentration remains the same within the intravascular space as well as the interstitial and intracellular spaces, including the intracellular space of the red blood cells within the intravascular space. Because of this, in a normally hydrated person, fluid neither moves into or out of the intravascular and intracellular spaces. The effect of this solution is that as more is given, the blood volume of the intravascular space expands, which can raise the blood pressure as well. When this type of a solution is given to a patient who has hemorrhaged, it remains within the intravascular space until the body becomes stable. Then, over time, some of the fluid will eventually move into the interstitial and intracellular spaces, including the intracellular space of the red blood cells. We'll talk more about this in the use of isotonic solutions by midwives later on. Isotonic solutions are used primarily for patients with bleeding or hemorrhage to replace fluid volume. They are also used for patients with severe vomiting or diarrhea, as they provide both fluid and electrolytes to replace those lost from within the body. As they contain an equal concentration of electrolytes as the fluid within the body, there are no risks for electrolyte imbalance with use of them, even in large amounts. These are the most commonly used solutions in obstetrics and are the safest fluids there are for use by midwives outside of the hospital. 3 of the most common isotonic solutions are normal saline, known as NS, lactated ringers, known as LR, and 5% dextrose in water, known as D5W. Now let's take a look at hypotonic solutions. Hypo means low, and tonic refers to its tonicity or concentration. So a hypotonic solution is of a lower concentration than that of blood or the fluids within the body. When we introduce a hypotonic solution into the intravascular space, we dilute the concentration of the fluid there down, and as a result, the fluid in the interstitial and intracellular space becomes more concentrated than in the intravascular space. Remember, this applies as well to the intracellular fluid of the red blood cells within the intravascular space. Remembering everything we've learned about osmosis, water flows from an area of lower concentration to higher, so water would move from the intravascular space into the interstitial and intracellular spaces to bring things to an equal balance once again. There are a number of effects the administration of a hypotonic solution has on the body, especially if too much is given or if it is given too fast. Water is drawn into the red blood cells of the body. If too much is drawn in, or if it is drawn in too fast, it may cause the red blood cells to swell and even burst, called hemolysis. As you can imagine, if enough red blood cells undergo hemolysis, it can cause very significant problems within the body. As fluid is drawn out of the intravascular space, the volume there decreases. If the decrease is significant enough, it may result in a decrease in the blood pressure. A little bit of a blood pressure drop will likely not be a problem, but if the drop is too significant, it may cause problems. Lastly, fluid is pulled into the interstitial and intracellular spaces. If too much fluid moves into the interstitial and intracellular space, or over a prolonged length of time, it may cause the cells and tissues to swell and lead to edema. Hypotonic solutions are primarily used to prevent and treat dehydration. They should never be used for volume replacement, such as in a patient who is hemorrhaged, because of all the risks we just looked at and the fact that they would actually decrease the intravascular volume, not increase it. They may also cause electrolyte imbalance within the body, the most common being hyponatremia or low sodium. Sodium deficiency, if extreme enough, may lead to things like brain damage and death. Because of these things, hypotonic solutions should not be given at home. Patients given these solutions, especially if over a length of time, need to have careful laboratory monitoring of their electrolyte levels. 2 of the most common examples of hypotonic solutions are 0.45 normal saline, known as 0.45 NS or half NS, and 2.5% dextrose in water, known as D2.5W. Lastly, let's take a look at hypertonic solutions. Hyper means higher or greater, and tonic, again, refers to its tonicity or concentration. So a hypertonic solution is of a higher concentration than that of blood or the fluids in the body. When we introduce a hypertonic solution into the intravascular space, we cause an increase in the concentration of fluid there, and the fluid in the interstitial and intracellular spaces is now less concentrated than that of the intravascular space. Again, remember, this applies as well to the intracellular fluid of the red blood cells within the intravascular space. Following the principles of osmosis, water flowing from an area of lower concentration to higher, The administration of a hypertonic solution would draw water from the interstitial and intracellular spaces into the intravascular space to bring things to an equal balance. As with a hypotonic solution, there are a number of effects this has on the body, especially if too much is given or if it is given too fast. As we already talked about, water is drawn out of the intracellular space of the red blood cells. If too much is drawn out or too fast, it can lead to them shrinking and becoming significantly dehydrated. As fluid is drawn into the intravascular space, the volume there increases, and if the amount is significant enough, it may lead to an increase in the blood pressure. This can be great for quickly expanding the blood volume and increasing blood flow to the brain and vital organs, but if the increase is too significant, it may cause problems. Lastly, if too much fluid moves out of the interstitial and intracellular space, it may cause the cells and tissues of the body to become dehydrated. Hypertonic solutions are primarily used for rapid blood volume expansion and are ideal for situations requiring rapid restoration of blood flow to the brain and vital organs, for example, in the emergency room with trauma patients. Because they are so concentrated, they are rough on the veins and may cause damage to them. They may also cause electrolyte imbalances, especially of sodium, potassium, and chloride in the body. Because of these things, hypertonic solutions are rarely used in obstetrics, and they should generally not be given at home, as patients given these solutions, especially if over a length of time or in large amounts, need to have careful laboratory monitoring of their electrolyte levels. There are certain situations where a hypertonic solution is recommended by some for use in labor. We'll talk about this more in the next video. Examples of commonly used hypertonic solutions are 5% dextrose in lactated ringers, D5LR, 10% dextrose in water, D10W, and 5% dextrose in normal saline, D5NS. If you note, it is the addition of dextrose to these solutions which make them hypertonic, which leads to one last thing we have to talk about: dextrose solutions. Dextrose is a simple sugar, which the body quickly metabolizes and breaks down once it is given. When that happens and the dextrose is metabolized, we are left with a solution of a different tonicity, and the effect of that solution on the body changes. So if we take D5W, which we know is an isotonic solution, and D10W, which we know is a hypertonic solution, once the dextrose is metabolized, we are left with just water, a hypotonic solution. If we take D5LR, or D5NS, which we know are both hypertonic solutions, once the dextrose is metabolized, we are left with LR and NS, both isotonic solutions. This is something very good to keep in mind if you consider giving a solution with dextrose to your patient. So these are the basic things you need to know about the different types of IV solutions and how they work within the body. In the next video, we'll talk about the uses of IV therapy by midwives.